St. Lucians are urged to do all they can to enjoy the Easter holidays safely, particularly by the beach. Given historical trends, the Easter holiday is known for unfortunate drowning incidents. Chief Medical Officer Dr. Sharon Belmont-George is appealing to the public to keep a close eye on minors at the beach.
The Ministry of Health and Wellness advises St. Lucians to make responsible decisions to keep safe during and after the Easter weekend. Traditionally, it's a time for family activities and socialization. This year may be different for many with the protocols that have been put in place for the management of COVID-19. Despite the difficulties in the past year, let us remain focused on what is truly important: health, family, and life. We acknowledge and applaud the public for their cooperation during the last few difficult months of managing this third and intense wave of COVID-19 in country. We ask the public to celebrate the long weekend responsibly. Avoid excessive alcohol consumption, avoid driving under the influence, drive within the speed limits, and manage conflict safely, especially since we note the increases in violent crime over the last few days. If accessing the beach, do so with caution and monitor young children closely. The Easter weekend is noted for drownings and near-drowning events.
Dr. Belmont-George also reminds the public to keep socialization at a minimum to slow the spread of COVID-19. She adds that the authorities are working on reducing the number of cases to 50 to resume social activities.
In relation to COVID-19, the public is reminded that although the Ministry of Health notes the flattening of this third wave, we still have over 100 active cases in country. We would like to alert the public that mass crowd activities and open socialization is not recommended nor approved at this time in our management of the pandemic. We are still at high risk at this point. The public health team is working to reduce the cases to less than 50 to enable safe opening up of activities. We ask the public to work with us and continue to be patient. The premature social activity will lead to an upsurge of cases given the exponential transmission typical of this virus.
Medical officials encourage the public to follow COVID-19 protocols to decrease the odds of infection during the Easter break.
We need to continue adhering to the infection prevention and control measures that are proven to reduce transmission of the COVID-19 virus and keep us safe. These include the following: wash your hands often with soap and flowing water or use alcohol-based hand sanitizer. Wear your mask, which covers your nose, mouth, and chin. Maintain physical distance from others and avoid crowded activities. Let us work together to ensure healthy lifestyles for Easter and beyond.
The authorities have revised the curfew hours for the Easter holidays in an attempt to curb the spread of COVID-19. While intimate gatherings of 10 are permitted, mass crowd activities are strictly prohibited. Gina Filippi, HCS News Force.